Hi, my name is Rochelle Franklin, and I just wanted to go over first my 355 capstone proposal. This was inspired due to an incident at work where there was a close error for a pediatric dosing in dexamethasone. So that capstone proposal or question was, will conducting education to medical staff who work in emergency care department to use their knowledge to establish interventions for pediatric patients and decrease medication errors at a rate of 20% over a 90-day period. So that was kind of my recap on my 355 proposal. But this one, I would say that I was inspired by what our professor first said in one of the webinars, how someone was very interested about infection control and using the same keyboard during COVID. And I started thinking, how can I apply infection control to my experiences? And I used to work in an outpatient surgery center. I currently work in an urgent care, but the outpatient surgery center, we would change our privacy curtains on a quarterly basis. But I still thought, why would Jayco allow a cloth material to be up around a patient for so long? Granted, if they're not soiled, but we would change them if they are soiled right away. Still kind of thought like, it's not a wipeable surface. So that's kind of what inspired this capstone question and project. So what is your capstone project question? It is, our privacy curtains and infection control concern was the big topic that I came up with. And then you can break that down a little bit, which I broke it down into conducting, educating medical staff on prevention of infection control regarding privacy curtains lead to opportunities in the break of the chain of infection from a 35% to a 20% in a period of 6 months. And then, what is the purpose of your capstone project? My purpose is to ensure the prevention of infection control to patients via commonly touched and used items, such as privacy curtains, because we do all touch them. Items such as privacy curtains are dependent upon policy or staffing noticing if they are soiled. And I just think that we have an opportunity to improve on that process. What is the significance of your capstone project? The significance for me is to better serve our patients and have alternatives to cloth privacy curtains or curtains that are treated, which I believe that there are curtains that are treated with chemicals that help prevent them from holding microbiome to prevent serious injury, especially if you have someone unstable, such as like an ICU patient, and we're exposing them potentially even more just because we have a curtain up that was changed 4 months ago. That was kind of my question there. What would be your plan to implement this proposal? The plan is to implement policy and procedure to test and regulate privacy curtains to ensure infection control efficacy. That would be all the questions. If you have anything else for me to add, I know I would like to also kind of dive in to shower curtains and hotel curtains, because those are also very risky. And of course, in the hospital, we do use shower curtains as well, and sniffs, why should we be exposing our most vulnerable patients to that possible introduction to infection by, not changing them? Well, thank you so much. I hope everyone has a wonderful semester. Bye-bye.